Greetings, dear students. I will be speaking to you on the medial collateral ligament. Again, in much the same similar headings as the posterior cruciate ligament was covered in. A little bit on anatomy, relevant biomechanics, clinical assessment, imaging, and treatment. Now, the most important thing that you need to know about the medial collateral is that it has two main parts. The superficial MCL and the deep MCL. And of course, there's a third part known as the posterior oblique ligament, which a lot of people consider to be a part of the posterior capsule. And that is the reason why I've not mentioned it separately. You also need to know that the superficial MCL starts well below the level of the knee joint, just like the posterior cruciate ligament. Now, these three bony points are very important to reference when you are lost or when you want to go somewhere, look at some landmark on Google Maps. You need some references. So on the medial side of the knee, these are the three references: the gastrocnemius tubercle, adductor tubercle, and the medial epicondyle. And this is how the various structures of the knee are attached with respect to these references. And you would note that most components of the MCL, the superficial MCL, the posterior oblique ligament, they are in a region between the medial epicondyle and the adductor tubercle and the gastrocnemius tubercle. There are published distances which you can reference from the excellent work of Dr. Rob Leprard. And also note that the superficial MCL has one attachment just below the joint, around 2 centimeters below the level of the joint on the tibia. Most of the attachment of the superficial MCL is actually 6 centimeters below in this hard bone of the cortical tibia. Now, this is a line diagram of the various structures of the MCL. You see the fan-like, unlike ACL, PCL, this is a flat tubular ribbon-like ligament. And one thing which I would want you to appreciate is its very close association with the hamstring tendon semimembranosus. In fact, semimembranosus is one of the lighthouses when we want to locate the tibial attachment of the medial collateral ligament, especially the posterior oblique ligament. And when we want to locate the femoral attachment during surgery, the adductor magnus tendon serves as our landmark. It attaches very close to the adductor tubercle of the knee. This is another line diagram in which you see that the posterior oblique ligament, that is essentially a condensation of the posterior part of the superficial medial collateral ligament. And again, note the very close attachment of the semimembranosus tendon in relation to all these structures. This is a cadaveric specimen of the deep MCL. The asterisk is the medial epicondyle. This is the meniscofemoral portion and the meniscotibial portion of the deep MCL with the medial meniscus right in between. And then these are the various arms of the posterior oblique ligament. There is a capsular arm, there is a central arm. So all this is very beautifully shown in this cadaveric specimen on the left. And again, note the very close relationship of the semimembranosus, how its point of attachment really defines the anatomy of the posterior oblique ligament. So all this is very important when you look at surgical reconstructions. And also note the direction of these fibers. This is the deep MCL and this is the posterior oblique ligament. Both of these fibers are directed differently, and that is why different portions of the MCL have different biomechanical functions.